we're very excited today to welcome Dr. Airín Denise Martínez. Dr. Airín Denise Martínez is a faculty at the University of Massachusetts Amherst at the School of Public Health and Health Science. Thank you, Dr. Martínez, for being with us today.
Absolutely. Thank you for having me.
Great. Today we are at the APHA 2023 and you work in public health. Can you tell us a bit about what you do in public health?
So my main focus in public health has always been to examine the social determinants of Latino, Latina health, and more specifically, how different institutional arrangements, policies, and programs shape health inequities in Latino communities. I've been in Massachusetts now for 5 years, and I have 3 main projects. One is examining the effects of institutional and interpersonal racism in Latino parent-youth dyads, or teenagers and their parents, to see if experiences of racism at the local, individual level, and interpersonal level shape chronic disease risk later in life. And then the other major project that I'm working on is I lead the behavioral science team for a suicide prevention program in the state of Massachusetts. And one of our vulnerable populations that we're focusing on are Latino working age men, Latino and Latina working age men. Although Massachusetts is number 48 in the country for suicides, Latino suicide rates continue to rise in the state. So my team has been tasked with diversifying the representation of the coalitions for suicide prevention, learning from Latino working age men, why is it that they're having struggles, what are their barriers, facilitators to mental health, and what are their recommendations. I love that project because in real time, as we're collecting information from the men, we're changing the different suicide prevention initiatives that the state has and the programming. So I'm very proud of that work, even though I don't really study suicide, but racism does matter even in that project in terms of access to healthcare and the services that men have. And then my other project is, if I could only remember that project. Yes, I actually received a grant with my community partner, Nuestras Raíces, which is an urban agricultural organization, to do a culturally responsive produce prescription program for type 2 diabetics in an accountable care organization. So they have mass Medicare or Medicaid ACO health insurance. Yeah, so those are my 3 major projects.
Very busy, very important work. Now you are with the Latino Caucus as well. Can you tell us about the Latino Caucus and what's your role with the Latino Caucus?
So the Latino Caucus is a standalone 501c3 organization, but it does have an affiliation with the American Public Health Association. It's one of the only caucuses at APHA that has its own nonprofit status. But I think the main goal is to increase the public health workforce to represent Latino, Latina populations in the U.S. to address Latina health equity and inequity. So yeah, I'm very proud of the Latino Caucus. So my role was, I no longer am on it, but I was the chair of the scientific committee. So I oversaw the scientific program that we had in APHA.
Now the theme for the Latino Caucus this year is La Cultura Cura. Can you tell us what it is? What does it mean?
Oh, it can mean many things, but I think I've seen this before when I was working on the U.S.-Mexico border. But basically, I think, so sometimes in public health discourses, there's this push for us to acculturate, right? To U.S. culture, to learn the language, which is it's a good thing too. But I think that if we also recognize the traditions, the rituals, and the lay health practices of our ancestors, and one of them being community and familism, that we could also benefit in that way. Our communities benefit in public health this way. So I think that's what it means to me. That's the way I've seen it manifest in even our produce prescription program. We provide fruits and vegetables for people who have type 2 diabetes, but because we're working with this organization, Nuestras Raíces, they're all culturally responsive. So they grow cilantro, they grow recao or culantrillo, they grow the ajíes or the different peppers that people use in their recipes, and that's important for them because they can replicate not just the foods that are from their culture, but they could also modify them in a healthy way. So yes, la cultura cura.
So la cultura really has
it cures, yes.
Yeah, it's a really strong base that impacts health and public health in general. Great. So what's in the pipeline for Dr. Martinez?
So our suicide prevention project is entering year 4. So we're expanding the project not just in the eastern part of Massachusetts, but the western part of Massachusetts with a focus on veterans and military service members. And then the other project that we're working on in terms of the racism project with the Latino youth, we're trying to analyze our data so we can come up with a resilience or strengths-based intervention for parents to speak to their children about how they experience racism and what are things that we can do to mitigate the physical reaction or the physiological response from racism for the kids. Yeah.
Great. Thank you for sharing, Dr. Martinez, and thank you for being here with us. Thank you.
Thank you for having me. Gracias.